Hey everybody, and welcome back to the channel. My name is Dr. Strong, and today we're going to be talking about how to stop snoring. So this is something a lot of my patients ask me about. Maybe they're not getting a restful night's sleep and they're curious why this is happening. So I wanted to make this video because in the last couple of months I've been struggling with it as well, and I really wanted to dive in and figure out what's going on. I was experiencing more brain fog, had more fatigue, wasn't waking up very well rested. And so when I looked into it, after cutting out caffeine, not eating very close to my bedtime, and optimizing my sleep temperature, everything else, I was still waking up feeling only about 70 to 75% of what I felt that I should. So there was another 30 to 25% that I felt like I could gain from optimizing my sleep even more. So after doing a little bit of research and checking if I was snoring, which I was, I took a deep dive into this to figure out what was going on and how I could fix it. So what is snoring? Snoring is narrowing of the airway, which is causing vibration of the soft tissue in the airway passage. So the main cause of this is the anatomy, so of the mouth and the sinuses. So if the jaw starts receding back, this can happen due to multiple factors. It can be to your own natural anatomy. It can be weakness of certain jaw muscles that hold the jaw in place. But as you go to sleep, you're going into that relaxation mode, which causes the muscles to relax. And especially with your sleep position, which we'll talk about as well, that can cause the jaw to move back. And if it moves back enough, what it's going to do is it's going to narrow that airway. This impedes oxygen delivery, which is super important, especially if you're trying to rejuvenate and recover from a very long day. Which, seeing patients all day, it was something that I needed to make sure that I'm at my 100% when I'm helping people resolve their health issues. So there can be anatomical abnormalities. This is more so if you experience it if you're younger. As you get older, there can be slight changes to the jaw structure and the sinuses, but most of the time you're going to have it even from a younger age. From the anatomy, if you have an inset jaw or if you have any abnormalities in the sinuses, that can cause it. So that's something obviously you can talk to your dentist about, ask them if there's, if they see anything, get x-rays or other studies. Another cause is alcohol. So if you're drinking a lot of alcohol, then what will happen is it can actually cause too much relaxation, and that can allow that jaw to recede back further. And obviously, your sleeping positions, if you're intoxicated, are going to be different. And so you may be in a bad position, which can cause the restriction of the airway even further. So alcohol, no matter what, is something that I always educate my patients on, that they really want to limit, because it really doesn't have any beneficial effects other than affecting your hormonal system. If you're a guy, it can actually lead to more estrogen increase. And especially for the patients we see here in the office, neuropathy, there is something called alcohol-induced neuropathy. If you have that or know somebody who has it, go check out some of my other videos where we talked about that. Now, allergies can cause this as well. So for me, allergies are most likely a gut problem. So if you have any type of gut issues and you have allergies, it's something that you really want to address. But with these allergies, it causes inflammation in the lining of not only the stomach, the esophagus, but your nasal passages, your sinuses. As you get more inflammation, that's going to decrease the amount of airway passage that there is. And so that can lead to snoring as well, especially at night. If you're somebody who experiences more allergies when you go to bed, you definitely want to check your bedroom for any type of mold. You definitely want to check and see if your bed sheets, if you have any allergies, making sure you're using a hypoallergenic laundry detergent if that is the cause. But that is something that you want to look into as well, just to make sure. And you have to do some testing more so with that just to see. Cold can cause it as well. And then obviously weight is a huge one too. So the weight, if you have excess weight and that stomach is moving up and compressing the chest, or if it's putting more pressure on the airway, it's obviously going to restrict it. So losing weight can be a huge factor. when I see most of my patients that are going in for sleep studies, a lot of them have, 20, 30, 40, 50 pounds that they need to lose. And I do have past videos about that. You can go check those out if you want to, but your weight plays a big part into this. Now, you may be asking, why does this matter? Well, sleep apnea, I actually had a friend who was a bodybuilder in college, and he had extremely bad snoring. And he had sleep apnea, but he didn't have a CPAP, he didn't address it. And he actually ended up dying at, in his mid-20s. It was really sad. So this is just another reason that whether you're the spouse or you know somebody or if you hear a friend, share this video with them. Let's get some education out there because, for me, it really impacted that, oh, wow, like this can actually cause death in somebody that's younger as well. But when it comes to sleep apnea, it is periods of no breathing. So when they have that kind of jerking motion, then that means that their oxygen tells them to wake up because they're not getting any oxygen throughout the body. With this, if this is extended, that can actually lead to brain damage. It can lead to heart damage. It can really stress the heart. It can lead to other metabolic issues. And the health risks associated with this are that you're going to get less sleep that's restful. You're going to feel fatigued. This can be common in chronic fatigue as well. It can cause irritability and trouble concentrating. So even for your kids, if you hear them snoring and they're having trouble in school, this can be something that you look at. Or if you associate with any of these, you don't have like really any autoimmune issues, you're pretty healthy overall, but you struggle with these issues, then you definitely want to look and see if your sleep is being impacted, see if you are snoring. There is an app that you can use, I can't remember the name of it, but I'll put it in the description below so you can check that out, that you can actually measure and see. And then also with this, the health risk, it can put strain on your heart. This can lead to increased blood pressure. So if you do have increased BP, it could be that maybe you have sleep apnea. It can also lead to heart disease and even sometimes strokes in the worst cases, which, these are some of the leading causes of death in America. So there may be more underlying causes for these issues than we really think. And then also brain, any type of, if you're having cognitive issues, if you're just having brain fog, then oxygen deprivation in the brain for however many hours you're sleeping is a huge issue, which is why it needs to be addressed. So this is why you need to recognize snoring, why it matters, and so now let's go over how you can address it. So I actually got this device, and it's a anti-snoring device. And so it's actually really neat. And what it does, it actually brings your jaw forward as you sleep. And it took a little bit of time to get used to it. But when you put this in your mouth, it's weird because the bottom actually sits out further, but that helps keep your jaw protruded further. And then it tells you which one is the upper, which one is the lower. This came with 2 different sets so that you could use whichever one is more comfortable for you. But you just put it in the mouth and it'll feel a little uncomfortable. What they suggest is that you wear it for 20 to 30 minutes before you actually start a full night's sleep, just so you can get used to it. But you just put it in and that's it. So, and it brings that bottom jaw forward. For me, sometimes I like sleeping on my back. So sometimes I notice that I snore more when I'm on my back. But with this, it actually brings that jaw forward and it allows me to get a much better night's sleep, especially if I roll onto my back throughout the middle of the night. I'm not waking up because I'm snoring. So this, I'll put a link to it in the description below. It's really easy, really simple to use. It's pretty comfortable once you get used to it. But if you have any questions about it, then just comment below. But check this out if you're looking for a simple way where you're not using a CPAP machine. You're wanting to avoid kind of all the wires and the tubes. I think too many people just let this go on for too long and then they end up having to get a CPAP machine. And it's something that can be addressed really simply if you catch it early enough. So thank you for watching this video. Hopefully this helps you understand the risk associated. If you are having trouble with it, highly check this out highly recommend it. And then if you are looking for a fix, if you're looking for a simple fix, then I'll put the link to this device below. And yeah, comment with any questions. I'll see you all next time. Bye.